Well, good afternoon and welcome to the Healthy Ages Wellness Program. And I'm Corey and I'm a Healthy Ages Specialist. And I'm excited today to introduce Dr. Gamboa. He works for Kadlec Clinic Hematology and Oncology. And I'm going to talk to us a lot about the C word and hopefully educate us quite a bit on stuff with the C word. So I'm going to turn it over to Dr. Gamboa.
So can everybody hear me? Okay, all right, let me see if this works. So like Corey said, my name is Dr. Gamboa. I'm a medical oncologist. That means I'm a doctor who takes care of patients with cancer. I'm also a hematologist, a blood specialist. There are some familiar faces in the audience that I can see today. So today we're going to talk about the ABCs of cancer. And let me see if this works. So the longer title is All You Wanted to Know, but We're Afraid to Ask About Cancer. All right. Okay. So let's start off with some objectives for this talk. Hopefully we'll be able to answer these questions at the end of the talk. What is cancer? What causes cancer? What are the signs and symptoms of cancer? What are the most common cancers? How is cancer diagnosed? How do we treat cancer? And how can cancer be prevented? All right, so have any of you read the book Emperor of All Maladies? Nobody. It's a very good book. It outlines the history of cancer. But interestingly enough, cancer was first described by an Egyptian, Imhotep, in 3000 BC. And it was described on that little papyrus right there as a bulging tumor of the breast, for which there was no treatment other than cautery and palliation and remote sympathy. So pretty much back in the day, if you were diagnosed with cancer, there wasn't much you could do. Very different nowadays. We have lots of treatments for cancer, and we are curing many patients with cancer. That's right, 3,000 years. So the term was first coined by Hippocrates, father of medicine, as karkinos, which basically means crab. So here is a picture of a crab, as you can see. And onkos, where the word oncology is derived, means a mass or a tumor or a load. So I think Hippocrates actually chose a very good description of cancer. So many people say that cancer is very much like a crab. For what reasons? First of all, if you get caught between those pincers of the crab, that's going to be very painful. And pain is one of the symptoms associated with cancer. Also, if you can see all these arms branching out of the crab, they say that that kind of represents the blood vessels that go in and out of a cancer. And one of the things that we know from cancer medicine is that in order for a cancer to survive, it must have blood supply. And again, onkos means mass or load, and most tumors or most cancers present with a big mass, a breast mass, a lung mass, a mass in the colon. And it's felt too that cancer is a heavy burden or a load, not just to the patient, but to the family who has to take care of the patient with cancer. All right, so what is cancer? It's basically a group of diseases involving abnormal cell growth with the potential of invading or spreading to other parts of the body. So here you see a cartoon of cells. These are normal cells. If you look, they look kind of nice, kind of organized. The cells look pretty much alike. When the pathologist looks at the microscope, cancer cells, however, are very different. They're bigger. Those cells in the middle, these are called nuclei. For those of you who are biologists, you can see that the middle of the cells are much bigger and the cells look very disorganized. So that's what the pathologist sees when he looks at under a microscope for cancer. Cancer is named after the organ of origin. So this is a question that I get asked a lot by many patients. So it's not, I would say it's very often that I see a patient and they say, oh, you know, my mom was diagnosed with breast cancer and she also had lung cancer. But really what happened was mom was diagnosed with breast cancer and unfortunately the cancer spread to the lungs. So those are two different things because in that case, in that patient's mom's case, she had breast cancer that went into the lung rather than having lung cancer itself. Although there are some patients who will have two kinds of cancers. I know a patient who has 3 different kinds of cancers, and obviously that's not a good situation to be in. So here's just a little cartoon. Cancer can start from anywhere: the ovaries in women, breast in women, lung in both men and women, and they can spread to different organs like the bone, the lungs, the liver. And that's pretty much how cancer kills people, is that they take over the function of the other organs. If there are any questions, please feel free to ask. This is going to be very informal. So, what are the causes of cancer, or what causes cancer? So all of you know that carcinogens cause cancer. And by far the most carcinogenic of all these substances is smoking. Hopefully we don't have smokers here. Radiation, Hanford, can sometimes be linked to a cancer. Chemicals, pesticides, Agent Orange, for those of you who served in the military back then. Diet and exercise. We know now that diets that are high in red meats, high in fats, low in vegetables, low in fruits, are associated with colon cancer. Diets with high salt and fat content, and a sedentary lifestyle. We know that patients who are active, who exercise regularly, have a less incidence of cancer. Infections can cause cancer. Back in the 80s, when we did not know what HIV was all about, there were many men, gay men, who developed a condition known as Kaposi sarcoma, which is a cancer of the skin. And they could not tell where this came from until finally we found out that it was because of the HIV virus, which pretty much suppressed the immune system and caused these cancers to occur. Hepatitis C can cause liver cancer. The human papillomavirus can cause cervical cancer in women and anal cancer in both men and women. Parasites. There is a worm known as schistosoma, not present here in the United States, but in the Middle Eastern countries where these parasites can go up your bladder and they kind of live in your bladder and cause cancer. Genetics can cause cancer. So there are several kindreds or families where every woman in the family had cancer. Grandma had cancer, mom had cancer, sister had cancer, and it is now known as the BRCA1 or BRCA2 mutation. So it is something that is inherited. Hormones can cause breast cancer. So we know from multiple studies that when women receive hormonal therapy beyond their menopausal years, or if men receive testosterone for low T, there's a higher risk of developing breast and prostate cancer, respectively. Autoimmune diseases, such as rheumatoid arthritis, lupus, Crohn's disease, which is inflammation of the colon. These can cause cancer as well. And basically it's because of the continued inflammation that happens in these organs. We know that inflammation, infection, these are not good things, and they lead to cancer. Obviously environmental exposures, The sun, UV irradiation can cause melanomas and other skin cancers. Asbestos, folks who worked in sawmills because of all the dust that they inhaled, and coal mines, and many others. Okay, so let's talk about the signs and symptoms of cancer. And here is just a small cartoon of some of the signs and symptoms. And as you can see, there's a big mishmash of signs and symptoms. They can be very specific or they can be very non-specific. And I always tell my patients that if you feel something that's unusual for you, please go ahead and tell your doctor. So let's go through them a little bit. So let's choose some of these. So back pain. Back pain is a very common symptom. Many patients will have back pain. Many people will have back pain. Doesn't mean that you have cancer if you have back pain. But if you have back pain that does not improve over many weeks, back pain that is not positional, or back pain that does not respond to your Tylenol or your ibuprofen, it would be a good idea to go to your primary care doctor and say, hey doc, I've just been having this pain in my back for the last few months. It's not getting any better. I was told that this could be a sign of cancer. I think that most cancers are diagnosed when a patient has a high index of suspicion, meaning if a patient is proactive about signs and symptoms, if they feel that something's going on that is not usual for them and they tell their doctor, that's how we find out most of the cancers. Constipation can be a sign of cancer because if there's a tumor in your colon, that can cause blockage. And if you're not having bowel movements, that might be a sign of cancer. On the other hand, patients with diarrhea can also have cancer. Diarrhea that does not improve despite all the stuff that you take. There are cancers known as neuroendocrine tumors, which secrete hormones, and these hormones can cause diarrhea, and that is one of the presenting symptoms of neuroendocrine cancers. Difficulty eating and losing weight. I have many patients who say, you know what, doc, I lost 30 pounds. So happy. I haven't been doing anything about it, but I'm losing weight. And I always tell patients that if you are intending to lose weight, if you are exercising, if you're dieting and you're losing weight, then that's good. But if you're losing weight for no good reason, that's not too good. That could mean cancer, that could mean thyroid disease, that could mean kidney disease. So for those of you who are very weight conscious and you're losing weight, but you're not trying to lose weight, that might be a sign that something is going on. Not necessarily cancer, but other health issues. Fatigue or tiredness. I can't tell you how many patients I've known who were referred to me just because they didn't feel right. They were very, very tired. Nothing that they did would relieve their tiredness. They slept all day, they couldn't get up like they used to, and true enough, these patients were diagnosed with leukemia or other types of cancer. Nausea and vomiting, pretty much the same as if you had an obstruction in the, or a blockage in your esophagus, that might cause nausea and vomiting. Patients who have brain tumors may have headaches and nausea and vomiting. So here is just another way of presenting the signs and symptoms: lumps and bumps, non-healing wounds of the skin, fevers, night sweats, unintentional weight loss or weight gain, fatigue, bruising and bleeding, changes in bowel habits, changes in urination, pain. And when I talk about pain, it's usually pain that's localized or confined to one area. Like, why am I having left hip pain and it's not going away? If you have generalized pain, that's probably less likely to be cancer, but if there's one spot in your body that just doesn't seem to get better, that might be a symptom of cancer. Headaches, obviously seizures, cough, shortness of breath, coughing up blood, those are signs of cancers. All right, so there are several types of cancers, and there are at least 5 different types, but I put here the 3 most common types because I'm asked by patients, well, my mom had a carcinoma, and my aunt had a lymphoma, someone had a sarcoma. What are the differences? And all of these are cancers, but there is a classification of cancers, if you will. So carcinomas, which tend to be the most common cancer, are cancers that arise from the glands and the skin. So these arise from organs like the breast carcinoma, colon carcinoma, lung carcinoma, prostate carcinoma. Those are the most common cancers. Sarcomas are tumors that arise from connective tissue. And what are the connective tissues? Bones, cartilage, muscle. These are connective tissues. Lymphomas and leukemias, this come from our blood-forming cells. So lymph nodes, leukemias, these are the lymphomas and the leukemias. There are two others. There are blastomas, which cancers that come from precursor cells, and germ cell tumors. Germ cell tumors come from cancers that arise from the testicles and the ovaries. So, but I didn't put those down because those are less common. All right, so I wish this were bigger, but it's a nice drawing or a nice diagram of what are the leading causes of death here in the United States and pretty much in the world, actually. All the cancers put together, lung, colon, breast, melanoma, lymphoma, leukemia, if you were to lump all of those together, it is still the second leading cause of death. The leading cause of death, as you can see in the diagram, is heart disease. So cholesterol building up in the heart, atrial fibrillation, these are very serious conditions. So care of the heart is very important. See your cardiologist. Go to your primary care doctor. Make sure that you're watching your cholesterol, watching your sugar intake. And the thing that I always tell my patients too is that any good thing you do for one organ system will be good for the others. Because if you prevent intake of cholesterol, or if you watch your sugars, or if you exercise, or if you watch your weight, not only is that good in preventing cancer, but that also prevents heart disease, it prevents lung disease, it prevents kidney disease. So any good thing you can do for one organ system is likely going to be good for the other organ systems. So heart disease, cancer, third is stroke, fourth is lung diseases, accidents, diabetes, Alzheimer's, flu, so get your flu shot, kidney diseases, and a small wedge of sepsis, which is basically infection that goes into the bloodstream, and by the time it's diagnosed, it's often, patients often get too sick. Okay, so let's talk about the most common cancers in men. So here's another diagram, and I'd like to take your attention to prostate cancer. As you can see, prostate cancer is the most common cancer in men, about 25% of cases. Second is lung cancer, about 15% of cases. And third is colon cancer, about 10% of cases. And there's a whole smattering of other cancers in this chart. And I want you to remember this, this picture, because we're going to go back, or at least a different version of this a little bit later. But again, prostate, most common in men. Lung, second most common in men. Colon cancer, third most common in men. So let's talk about the ladies. The most common cancer in women is breast cancer, about 26%. Lung cancer, 14%, and colon cancer. So there's a common theme here. Lung cancer and colorectal cancer are the second and third most common cancers in both men and women. And again, a whole smattering of other cancers here to the left. But if you ask an oncologist, or if you ask a doctor what is the most common cancer killer, in both men and women, it's lung cancer. So even if it's only the second most common type, most cancer deaths will be from lung cancer. And I think this is a very important thing, because lung cancer is one of the most preventable cancers there is. We know that majority, about 90% of cancers are from smoking. So for those people who are smoking, if you have a loved one who smokes, if you yourself smoke, please think about that. Smoking is bad not only for cancer, but this is bad for your heart. It's bad for your bladder. It's bad for your lungs. And you just saw what are the top 3, top 4 causes of death: heart disease, cancer, stroke, and lung diseases. All of those 4 top causes of death is linked to smoking one way or another. So lung cancer is the leading cause of death in men. Prostate cancer, although it's the most common, it's only second. And third is colorectal cancer. In women, it's the same. Lung cancer is still the leading cause of death in women. Breast cancer is the second, and colorectal cancer is the third. So again, a common theme. First being lung, third being colon, and in between is breast cancer, which of course is more common in women, although men can have breast cancer too, and prostate cancer, which at least I hope only happen in men. All right. We talked about this a little bit. How does cancer kill? Cancer kills when cancer spreads from the original organ and goes to another organ and takes over the function of that organ. So I like graphics. So here is a picture of the liver. This is the normal liver. As you can see, the liver is nice and brown, smooth. I like liver and onions. I don't know if you do. But nice and smooth. This is the picture of liver cancer. And as you can see, not only is the liver enlarged, but look at all of these things. These are cancers that have spread from the breast to the lung. And these are very, very hard. When you run a scalpel through that, that's calcified. It's almost like running a scalpel or running a knife through your countertop. It's very, very tough compared to running a knife through liver or butter. So as you can imagine, what is the function of the liver? The function of the liver is to detoxify what we eat. And if your liver was taken over by all of these tumors, then the liver can't do its job. And that's how patients die from cancer, is the kidney can't do its function, the liver can't do its function, the lung can't do its function. So let's say, for example, it went into your lung. Then patients would not be able to breathe as well, because instead of having that really spongy, really nice flow of oxygen through your lungs, if you had tumors in there that are very hard and very solid, you wouldn't be able to breathe. We have a question. So the question from this gentleman is, how does cancer spread, or where does it go through? So there are 2 ways by which cancer, or actually 3 ways by which cancer spreads from one organ to the other. By far the most common way that cancer spreads from one organ to the other is through what we call lymph nodes. Lymph nodes are organs that all of us have. Lymph nodes are part of the blood system, and they are involved in the transport of lymph fluid. We all have lymph nodes, and lymph nodes are very important in preventing swelling of your legs. Maybe some of you here have been diagnosed with lymphedema, where your legs are very, very swollen. The lymph system is an important component of preventing that from happening. The thing about the lymph nodes is that they are little passages for cancer. So if you have a cancer from the breast, they first spread to the lymph nodes in the armpit, and then from the lymph nodes in the armpit, they spread to lymph nodes near the lung, and then from the lung they spread, or from the lymph nodes they spread to the lung. So these are little channels, or little filters, if you will, where the cancer spreads to. Another way by which cancer spreads is through the bloodstream. So if you have a cancer of one organ, they can go. Are you okay, sir? Okay. All right.
Are you okay?
Yeah. Okay. All right. It can spread through your blood and go to other organs. There's a third mechanism called drop metastases, where cancers, let's say from the colon, can drop into the abdominal cavity and cause cancers. That's what we call peritoneal carcinomatosis, where cancers just drop from the original organ into the abdominal cavity. So that's a third. But by far the most common is through the lymph nodes, through the blood, and then drop metastases. All right. How do we diagnose cancer? So you've all heard about x-rays, CAT scans, mammograms, blood work. So here are just pictures of how we see cancer. This is a mammogram of a woman's breast with cancer. As you can see, again, a very a very dense looking mass in a woman's breast. Here is what a gastroenterologist sees when he does a colonoscopy. This is the normal inside of a colon, but you see that big mass there. And if this is not detected early enough, that can cause blockage of your colon. Here is a CAT scan of the lung. And as you can see, again, here is a mass on the right side of the lung. Here is a picture of a patient's brain. And unfortunately, there are 2 lesions, which is cancer that has spread from the organ to the brain. So sometimes we can pick up cancer through blood tests, urine tests when we see blood in the urine, and some stool tests. So, but more than any test more than any blood work or more than any CAT scan, I think it's important that you see your doctor if you have any concerning symptoms. Okay, all right. What are the stages of cancer? So in general, there are 4 stages of cancer. Stage 1 is when the cancer is confined to the organ where it came from. Stage 1 breast cancer is confined to the breast. Stage 1 colon cancer is confined to the colon. Stage 1 lung cancer is confined to the lung. Stage 2 cancer is when some of the cancers have spread to a few lymph nodes, which we talked about with this gentleman asked. Stage 3 is when it has spread to more lymph nodes. And unfortunately, stage 4 is when cancer has spread to the other organs, like the picture you saw of a person whose cancer went into the brain. In general, stages 1 to 3 can be cured by different treatments like surgery and chemotherapy and radiation therapy. Most stage 4 cancers, unfortunately, are terminal or fatal, where we can't cure patients, but we can certainly control their cancers. There are some cancers that can be cured at stage 4, lymphomas, for example, or leukemias. Those are generally curable even at stage 4 disease. Okay, so we're getting close to the end of the talk. So, but let's talk about the treatments. So you all know about surgery. What basically happens is a doctor who is trained in what we call surgical oncology, or a surgeon who trains specifically in cancer medicine, takes out a tumor. Radiation therapy, we'll talk about that here in a bit, and chemotherapy. This is what I do as a medical oncologist. And under the category of chemotherapy, you have your classic chemotherapy, there's hormonal therapy, there's immunotherapy, which is the newest thing. You've probably seen a commercial on TV on a drug called Opdivo. I'm not sure if you've seen that. And then there are targeted agents. Okay, so surgery. So I'm not a surgeon, but in order for cancer surgery to be successful, you must remove not only the cancer itself, but surrounding tissue that's normal. So here's a picture of a gentleman who had head and neck cancer. And so it's not simply a matter of taking off the tumor, but you have to take surrounding areas which have healthy tissue. And that's why you want a surgeon who does this every day. You don't want a surgeon who takes care of an appendix for most of his life and then says, hey, you have a tumor in your neck, let's take that out. You want a surgeon who's specifically trained in cancer surgery, and we have several of those at Kadlec. And here is a little picture that I like to show my patients all the time, which is basically the principle of surgical oncology. So here is, right here, I don't know if it shows well, but here is the cancer. It's kind of in the middle. When an experienced surgeon does surgery, not only does he take the cancer, but he wants to make sure that there is an area of normal tissue surrounding it. This is an example of cancer surgery that's not so good, where you have a cancer right here, and there's normal tissue out here, but the cancer is at the edge of the resection specimen. So what that basically means is that even if he took the whole thing out, there might be a few cancer cells that are left behind in the area where the surgery was done. And if that's the case, then those small cancer cells can grow back. Radiation therapy. This is the use of ionizing radiation to control or kill cancer. and it's usually delivered by a machine or a linear accelerator. You've probably heard about this, you've probably seen this on TV. Radiation oncologists are doctors who are trained in the treatment of cancer with radiation. And so now we'll talk, I guess, a lot about what I do as a medical oncologist. So let's talk about chemotherapy, because everyone probably knows about chemotherapy. So chemotherapy is the use of chemicals that kill cancer cells by interfering with a number of mechanisms. They interfere with cell division, they interfere with cell metabolism, they destroy the cancer cell DNA, and most of our cancer drugs are derived from natural compounds, such as the bark of the yew tree, periwinkle, mayapple, or there are some chemotherapeutic drugs that are synthetic, that are made in the lab. Hormonal therapy is the use of chemicals that interfere with hormonal function. We talked about breast cancer and we talked about prostate cancer. These are cancers that are driven by hormones. So if you have too much estrogen, too much testosterone, this can cause cancer to spread. If we use medications to counteract these hormones or prevent these hormones from being produced, then these cancers shrink or can even go into remission. So many women with breast cancer and many men with prostate cancer may get away with just popping a hormone pill or an anti-hormone pill. So there are examples here. Probably some of you have heard about tamoxifen. That's a breast cancer drug. Immunotherapy is the newest thing that we use in cancer medicine right now. And it's basically using your own immune system to kill cancer. So let's talk about this a little bit. There's a little cartoon here, but it's a little small. But the immune system is a very clever way of destroying things that should not be in the body. So if you caught the flu or if you caught a pneumonia, your immune system, these cells called lymphocytes, will go to the areas where you have a pneumonia, and they will gobble up these bacteria. The immune system also kills cancer. It's well known that all of us right here, right now, all 127 of us here, have cancer cells. But our immune system should be able to recognize these cancer cells and kill these cancer cells. What happens with cancer is when the immune system fails to recognize that these cells are cancer. So because of our clever scientists and doctors, they were able to devise or make new medications that allow your immune system to recognize these cancers. So normally, on this diagram to the right, this is the tumor, and this is the T cell. That's our immune system. In the normal situation, because the tumors are also our own cells, the T cells do not recognize the tumor as being foreign or being bad. So they don't kill the cancer. When we give these new drugs, it stimulates your T cell to recognize the tumor, and by so doing, the immune system cells are now able to recognize the cancer and kill the cancer. So that's the newest thing we have in our field as medical oncologists. That's the future, exactly. And so then we have targeted therapies. These are like the chemo pills that you might have heard of. And so here's an on and off switch. There's a drug called Herceptin, which is designed to turn off the mechanisms of breast cancer. Here's a little drawing where the HER2 receptor, if it's turned on, it causes these signals which tell the center of the cancer cell to keep on producing other cancer cells. So that's the on switch. But if we had a chemical or a drug that turned off that switch, and this is the chemical right here, those signals cannot reach the nucleus, and those cancers die. So that's what targeted agents are. 5 years ago, 10 years ago, we only had chemotherapy. We only had hormonal therapy. Now we have a whole slew of agents that we can use for cancer. All right, so just to summarize a little bit, treatment of cancer, often all forms of treatment are offered to completely cure a specific cancer. So let's use breast cancer as an example. A woman sees a surgeon, the cancer is removed. Depending on the kind of surgery that's done, that doctor or that patient may need radiation therapy, and depending on the cancer, depending on the stage, she may be offered chemotherapy. There are cancers that require surgery only, like if you had a localized skin cancer, or if you had an early kidney cancer, or early lung cancer, early breast cancer. Some of those cancers do not need further therapy. And then there are some cancers that need chemotherapy only, like leukemias or lymphomas. We don't take out the lymph nodes that have cancer. We just give you chemotherapy, and cancer kills, or the chemotherapy kills those cancers. So let's spend a few minutes talking about the 4 most common cancers. Lung cancer. I like this slide because it shows that smoking is the #1 cause of lung cancer. Is what a normal lung looks like. Pink, very spongy, kind of like the filter, your car filter. And this is what cancer looks like. The lungs are very black, full of nicotine, full of toxins. And as you can see, the heart is enlarged because the lung isn't working properly. And as opposed to this, where your lung is very spongy, this is a very hard organ. And as you can imagine, probably, the oxygen which normally goes through your lungs will not be able to go through when you have lung cancer. We all know that it's the leading cause of cancer death in men and women. 90% of lung cancers are due to smoking, although there's about 10% that just happens. No relation to smoking. Asbestos and radon can cause cancer, and symptoms, obviously cough, coughing up blood, wheezing, shortness of breath, chest pain. How do we treat lung cancer? For the earliest stages, for the early stages we do surgery. For more advanced stages we do surgery plus chemotherapy. For stage 3 cancers we do chemotherapy and radiation alone. We don't do surgery for that. And for patients who have stage 4 lung cancer, it's mainly chemotherapy and the immunotherapies and targeted therapies, which we talked about. Breast cancer. So here's a nice picture of some of the signs that a woman might notice when they have breast cancer. Notice a lump, or your nipple just doesn't look right, pulled in. There's dimpling of the skin. There's discharge coming from the nipple, redness of the skin or the nipple itself, skin changes. Okay. We all know it's the second most common, that's wrong. It should be, it is the most common cancer in women, but the second most common cause of death from cancer in women. Can be hereditary. Breast cancer may be due to a prolonged use of hormone therapy. So back in the day, every woman who was 50 or older, they went to their doctor and said, "Hey, Dr. Smith, I'm just having these hot flashes. I just can't sleep well at night." And the doctor writes you a prescription for Premarin or for hormonal therapy. And it makes women feel good. Their hot flashes go away. They feel energetic. They feel like they're young again. But we know now that giving hormonal therapy beyond the years that you're supposed to have hormones can cause breast cancer. Same thing in men. There's a lot of commercials about low testosterone and how, if you get testosterone, you'll have your sex drive back and you'll be able to do everything you used to do when you're younger. But we know that getting testosterone beyond the years that you're supposed to have testosterone can increase the risk of prostate cancer. Symptoms, breast mass, breast pain, can be seen on a screening mammogram. Treatment for breast cancer, surgery with or without radiation in most cases. Hormone therapy for patients who have what we call hormone receptor positive disease. Chemotherapy for more advanced stages or those who have hormone receptor negative disease. And hormones or chemotherapy for patients with stage 4. We have a question. Okay. So the question from the back from this lady is that, is hormones the same as birth control pills? And the answer to that is kind of yes, but mostly no. The compounds that we use for the treatment of breast cancer are estrogen blockers. What they do is they compete with the function of estrogen. And if you think about it, some of these birth control pills actually also compete with estrogen. So they're kind of similar in that way, but I have not heard of birth control pills being used as a treatment of breast cancer. So okay, but were you diagnosed with breast cancer? No, okay. So you're getting, you likely are getting hormone pills for other reasons. This is not for the prevention of breast cancer. Some patients get hormones so that they'll feel younger. Some patients get hormones so that they can suppress vaginal bleeding. Some patients will get hormones because it can suppress acne. So I don't know why you're being given hormone therapy or birth control pills, ma'am, but it is a way of hormonal therapy, but not for breast cancer. Yes, sir. Uh-oh. I'm in trouble now.
Thank you for holding this meeting.
Oh, you're very welcome.
My niece in Tulsa, Oklahoma, was been diagnosed with this breast cancer.
Okay.
About a month ago. She's into chemo now.
Right. Mm-hmm.
Her doctor has told her this is a very aggressive cancer,
okay.
HER2 gene.
Okay.
So you might talk about genes.
Let's go ahead and talk about that.
Give me your opinion on these other questions.
Okay.
I appreciate it.
All right, we will do that. Okay. Is it okay if we go back to this a little bit later? Actually, let's do it right now. So the question here is, there is a lady with stage 3 breast cancer who has the HER2 gene. Let's go back to the little picture that I showed you here. This is the HER2 receptor, and I'm glad that we brought that up. So some cancers have, some breast cancers, I should say, have this HER2 receptor that's present on the surface of the cell. And we know that if we target that HER2 receptor, that we cause these cancers to die. So your niece has a HER2 positive breast cancer. These are more aggressive cancers. The good thing about this is that we have a drug called trastuzumab or Herceptin, which shuts off that mechanism. So aside from chemotherapy, which she's being offered, they're going to add this drug called trastuzumab or Herceptin. And we know that if you get Herceptin or trastuzumab for breast cancer, the chances of curing your niece is much higher with this drug. So definitely the plan here for getting a drug called Herceptin is good. How many stages? There are 4, as we talked about. Will chemotherapy kill breast cancer? Yes, it will, but it depends on the stage that it's diagnosed. So stage 1 to 3, we can definitely kill cancer. We can definitely cure breast cancer. Stages 1 to 3. Stage 4, unfortunately, we can't. Surgery after chemo. This is probably, your niece was probably offered what we call neoadjuvant chemotherapy, where we give chemotherapy before the surgery to shrink that tumor. And then radiation, yes, depending on how big the cancer is. Stage 3 cancer means it's spread to the lymph nodes. So yes, I think radiation should be offered. So everything here that is you wrote on your piece of paper, I agree with that. She should get chemotherapy, she should get radiation therapy, and if it's a very big cancer that's HER2 positive, she should definitely get chemotherapy first before going to surgery. Yes, sir?
Are these drugs that you've mentioned the outlandishly expensive ones that you've been hearing about?
Unfortunately, all chemotherapy drugs, except for the ones that were designed when you were young folks, are pretty expensive. Medications are actually the greatest driver of healthcare. And I have no control over this, but cancer drugs are actually outlandishly expensive. Again, the pharmaceutical companies are the ones who drive healthcare. It's not the doctors, it's not, exactly, money. But yes, they are quite expensive. I wish there was a way that we could go around that, but there isn't. Yes, sir?
Could you comment upon natural ways such as IV, vitamin C?
Sure, yeah.
Types of things?
Yeah, so I've been asked that question a lot. And interestingly enough, most of our treatments for cancer are derived from natural compounds like the yew bark or periwinkle. So there is a role for natural therapies for any kind of cancer. You've probably heard of turmeric, which is a spice that they put in Indian food. There's a mushroom, I forget the name right now, which apparently does wonders for cancer. And when I'm asked this question, I always tell my patients, I think it's okay for you to take these medications, take vitamin C, take turmeric, take this mushroom that's being talked about, but none of these drugs, vitamin C, turmeric, have been evaluated by the FDA to be effective specifically for cancer. They've not been studied in a clinical trial. All our drugs that are now being used for cancer are studied in a clinical trial where half of the patients did not get chemotherapy and the other half got chemotherapy, and we were able to prove that the other half who got chemotherapy actually did better. So for these other things, vitamin C, turmeric and all, these are anecdotal benefits. I see no harm in some of them, but I always tell my patients, when you see a medical oncologist or a radiation doctor, and if you like the plan that they're recommending, go ahead with that conventional plan or that scientific plan. And if you want to do other things based on what your naturopath tells you, I think that's okay. Now, so the question from up front is, what is the role of sugar? And if you go back to my slides, first few slides, there was no mention of sugar. I was actually going to mention that. I'm glad you brought that up. So everyone says that sugar causes cancer to happen, or we have to starve the body of sugar to get rid of cancer. And this is what I tell my patients. Certainly, too much sugar is bad. It's bad for your heart, bad for diabetes, bad for cancer. But sugar is an important component of all our cells. Without sugar, we will all die. If you deprive yourself of sugar, sure, these cancer cells may be deprived of sugar, but then you also deprive yourself of the sugar. So to date, there has been no trial that has shown that a low sugar diet actually does better for patients. The only thing I can think of is that these patients are miserable because they're not eating their potato or not eating their rice. And you know, when you're getting chemotherapy, you want to be as strong as possible. You want to have those carbohydrates. You want to have those sugars. Certainly, you should limit your sugar because, again, anything in excess is bad. Too much sugar is bad. Too much salt is bad. But sugar itself causing cancer, that's not been proven. Yes, sir. So the question from this gentleman is that I said that radiation can cause cancers, but how does radiation cure cancers? So we all know that excess radiation that you might have gotten from Hanford, or if you got 20 different CAT scans or got radiation therapy for thyroid cancer, can cause cancer. It certainly can, because even chemotherapy can cause cancer, radiation therapy. So these are all external agents that we shouldn't be exposed to. But the answer to your question, sir, is that cancer cells are very actively dividing cells. So let's say you had a breast cancer and there were cancer cells there. They will focus that radiation only to that area where the cancer is. So as much as you are getting radiation to the breast or radiation to the lung, it kills those cancers in that area without radiating the others. The radiation oncologist will always tell you that there is a risk that you might develop other cancers when you get radiation. And I myself, when I talk to my patients about chemotherapy, I always tell them that there is about a 1% chance of developing leukemia or other cancers. But it's always a risk-benefit ratio. So how much do you stand to gain by getting chemotherapy? How much can we control your breast cancer when we give you chemotherapy? And what is that risk compared to the 1% chance of you developing leukemia? So when you weigh the risks and the benefits outweigh the risks, then you proceed. But yes, chemotherapy can cause cancer. Radiation therapy can cause cancer. Okay, we'll proceed. Most common cancer in men. So here is a cross-section of, the male genital system. The prostate is a little organ that sits between the bladder and the penis. within the prostate, cancer can also develop. So most common cancer in men, second most common cause of death in men. What are the symptoms? Difficulty urinating, blood in the urine, back pain when the cancer becomes advanced. It's estimated that all men, so all the guys around here, including myself, probably will be diagnosed with breast cancer if we live long enough.
Breast cancer?
Oh, sorry, prostate cancer. Sorry, it's getting late. But there was actually an interesting study where they did an autopsy on many men who died from a motor vehicle accident. And when they looked at these patients' prostates, they all had prostate cancer. So it just goes to show that cancer is present in everybody. But if our immune system is strong enough to keep these cancers at bay, then we don't manifest with the symptoms of cancer. Some very early stage prostate cancers don't need treatment. And that's true. Some of you may have seen your urologist. Some of you here may have prostate cancer. And you've been told by your urologist, hey, Mr. Smith, you have prostate cancer, but we don't need to remove that, or we don't need to give you radiation therapy, or we don't need to give you hormone therapy. And oftentimes that recommendation is the right recommendation. And the reason being is that prostate cancer is a very slow-growing cancer. So if you got surgery to the prostate or radiation to the prostate for a cancer that's very slow-growing, most men will have the side effects of getting surgery. They will not have erections. They will be peeing into a diaper their whole lives. And in some cases, that cancer that's there in the prostate will not spread or will not go to other organs. So if you have a urologist who tells you that, okay, Mr. Jones, you have prostate cancer, but we're not going to remove it, you're not going to get radiation therapy, you're not going to get chemotherapy, sometimes that's the right answer. So that's just an example.
You have a typo on that slide.
Yes, G. There was a G, right? Yeah. Thank you for pointing that out. I noticed that before but it was too late to correct. There are some surgeries. There are some cancers, early stages, you do surgery and radiation. For stage 4 disease, we do hormonal therapy. And chemo is used when hormone therapy is no longer effective. Colon cancer, nice drawing here of what your colon looks like when it's normal. This is the large intestines, very nice, very glistening, very smooth. And here is a picture of colon cancer where there's a big tumor in the middle. Third most common cancer in both men and women, third leading cause of death from cancer. Symptoms include changes in bowel habits, constipation, blood in your stool, weight loss. Again, high diet, red meats, and low in vegetables. Surgery for stage 1 and 2, surgery followed by chemotherapy in stage 3, and chemo alone in stage 4. Screening for cancer, very important. All men 50 years or old, all men and women 50 years or older should get a colonoscopy, and even younger if there's a history of colon cancer. All women who are 40 years or older should be getting a mammogram yearly, although there is some recommendations now that if you're 70 or older, that maybe mammograms are not as important anymore. I still recommend that all women get a mammogram once a year. Pap smears?
It should say or earlier.
Or earlier. Earlier if you have a risk of breast cancer, BRCA1, BRCA2. And then pap smears in women beginning age 21. So these are the 3 most preventable cancers, and these are the 3 cancers where screening is universally accepted by all medical societies. There's screening for lung cancer. Yes, ma'am. So if you've had, and I forget the number now, but if you're of a certain age, I think the number here is 65, please look it up. When you've had 2 or 3 consecutive pap smears that are normal, then you don't need pap smears anymore. And the reason being is that cervical cancer is a cancer of sexually active women. Not to say that 65-year-old women are not sexually active. I know many women who are sexually active at 65, but they're less likely to be sexually active at that time. 65-year-old women are less likely to have multiple sexual partners. So the risk of having HPV, which is that that virus which causes cervical cancer is less. So yes, so when you're of a certain age, if your family doctor says you don't need pap smears anymore, they're most likely to be correct. Lung cancer, there is a screening now offered for those who are heavy smokers. And for prostate cancer, very controversial, but I'm sure some of you have seen your doctors and they said, okay, we'll do a rectal exam and we'll do PSAs on you. It's very controversial, and the reason being is that, like I said, prostate cancers, when they're very early, you may not need treatment. So some medical societies will say, well, if we're not going to treat this 80-year-old guy for his stage 1 prostate cancer, why look for it? And so it's not universally recommended. Yes, sir. So the question here is, do you need a colonoscopy every 10 years? And in general, that is correct. So everybody should start getting a colonoscopy at 50 unless you have a history of colon cancer in the family. And if that colonoscopy is normal, it's every 10 years. If you're found to have a polyp in your colonoscopy, then they will do every 3 to 5 years. But yes, the bare minimum is once at 50 and every 10 years thereafter. All right, cancer prevention. Please don't smoke. Diet high in vegetables, low in red meats and processed foods. Vitamin D apparently is very helpful in prevention of cancers. Exercise. Use sunscreen. Avoid midday sunlight exposure. All right, so that wraps up the talk. Do you have any questions? Yes, ma'am. Okay, so who is Hodgkin's? I actually had a lecture before on the history of cancer. So Hodgkin's was a doctor back, I believe in England, way back, where I think he was a pathologist actually, who collected specimens. And he found, before lymphoma was diagnosed, he found all these masses in the neck. It was later found out that these masses in the neck are lymphomas. There are two types of lymphomas, the Hodgkin's and the non-Hodgkin's. By far, the non-Hodgkin's are more common, they're more aggressive. But Hodgkin's is it's a specific type of lymphoma, and it's named after him. So yeah, read the book, Emperor of All Maladies. It's very good. Yes, sir. Okay, the question here is when a gastroenterologist recommends stool samples, what is he looking for? Obviously, there are some patients who cannot get a colonoscopy because they're too old or they're on blood thinners. Sometimes we can detect blood or cancer cells in stool specimen. There's this thing that you see on TV now called Cologuard, which is a non-invasive way of doing colonoscopy, detecting cancer. Not a replacement for colon cancer, or not a replacement for colonoscopies, but certainly a less invasive way of looking for cancer. It looks at the DNA that they see on your stool. Okay, so the question here is, if I'm right here, sir, the question from this gentleman is, there's so many cancers, and we are trying to prevent all these cancers, but there's so many of them that you can't cure all of them. To an extent, that's true. I mean, there are many diseases that we can't cure. But in my mind, if we can detect the common cancers early, colon cancer, lung cancer, breast cancer, cervical cancer, then we are able to save lives if we detect them early enough. Of course, there are some cancers where you can't screen. You can't screen for kidney cancer. You can't screen for pancreatic cancer. But those are very rare. The likelihood that many of us here will be diagnosed with pancreatic cancer is very low compared to ladies having breast cancer and men having prostate cancer. So we concentrate on the cancers where there's a high risk of developing it. That's why our preventative measures are geared towards those 3 or 5 most common cancers.
So I'm going to let you guys go if you want to go, and then people who want to stay can ask Dr. Gamboa a few more questions. But thank you, and man, I learned a lot. I hope you guys did too.
Yes, ma'am.